Hello, all. Welcome, and thanks for taking time to join today's webinar. I am Dr. Dorado Brooks, and I'm the Vice President of Cancer Control Interventions at the American Cancer Society. ACS has partnered today with the nonprofit technology organization CareMessage to host this webinar for safety net providers. The webinar, as you all know, is on free COVID-19 resources and messaging platform for safety net providers. We know that this is an extremely challenging time for everyone and for healthcare organizations in particular dealing with COVID-19 issues across the country. And we also know that when America gets a cold, safety net institutions get pneumonia. And therefore, we hope that this session and what you'll learn here about this new technology solution can be valuable and help provide some immediate support to you, your patients, and your staff as you are trying to deal with the COVID-19 pandemic. I want to introduce our speakers today from CareMessage. First up will be Nina Parikh, who's the Director of Product, and she'll be leading this session. And then Christine Chang, a Strategic Partnership Manager, will be moderating the Q&A. Nina leads the product team strategy and vision at CareMessage. Before CareMessage, she worked at the Stanford Prevention Research Center, and she has her master's in public health from Washington University in St. Louis. So I'll now hand it off to Nina. Nina, I can't hear you.
Yeah, sorry. I was just trying to put myself off mute. Thank you so much, Dr. Brooks, and thank you to your colleagues and the team at the American Cancer Society for providing us with this platform to speak on today. I'm really looking forward to talking with you all about CareMessage, telling you who we are, what we do, and providing some more information about the efforts that we're going through to bolster our support of safety net providers during these challenging times. So first, just a little bit about CareMessage. We are a nonprofit organization, and our mission and vision has always been to improve the health outcomes of underserved populations using mobile technology. We are the first and only patient engagement platform that's really built for safety net providers and with underserved patients in mind. And we currently work with 200 free clinics, federally qualified health centers, and lookalikes across the country. And have reached over 30 million patients. So I wanted to give you all a broad overview of what we offer at CareMessage, our platform overall. So it's a web application that does provide integrations with some of the following features. So we do offer appointment reminders, group and direct outreach, so the ability to message patients both on a personal level and then in the thousands. And then we also offer health education programs. These are 3 to 6 month long SMS-based programs that are around a health topic or a chronic condition. So we have 19 of those, anywhere from type 2 diabetes to hypertension to adult obesity, stress management, anxiety. We also give you the ability to fuel your patient satisfaction surveys via our platform. And then we have patient referrals and a patient mobile app that's in the works right now. We have a ton of content that we've created over the years, over 300 pre-written templates that allow you to just go into our library, find the message that you need to send. Maybe it's around flu shots, maybe it's about well child visits, colorectal cancer screenings, fit kit reminders, and copy and paste them into our platform and send them to your patients. And because we are a nonprofit that is focused on vulnerable populations, we make sure that all of our messages we try to make sure that our messages are written at a 6th grade reading level or below, and they do come in English and in Spanish. So now turning our eye to our COVID-19 response, I think like a lot of organizations probably on the call today, I think one of the first things we did as a company was just think about how we can support our employees during this challenging time. What are the accommodations we can make, and what are the support structures we can put in place to make sure that our staff feels really well supported during this. And then we turned our eye towards how can we bolster our efforts to support our safety net providers that we work with. And so with that in mind, we did the following things. We created a dedicated COVID-19 task force on our team, and it's an interdisciplinary team of employees that is really focused on addressing customer concerns and questions regarding COVID-19. We make sure to, we ensure that all of our content is aligned with the CDC and what is currently out there. And then we want to make sure that we're also disseminating best practices widely across safety net providers that are working with us. In addition to that, we are also working closely with the National Association of Free Clinics and the National Association of Community Health Centers to make sure that more people know the work that we're doing and the free resources that we're offering at this time. And then the last two things, the free COVID-19 message library and then the free 60-day trial of CareMessage, or what we're calling CMLight, is what I'll talk about on the following slides more in detail. So for CareMessage Lite or CMLight, the features that you would receive is the ability to message large groups of patients in the thousands, and the ability to message patients individually via personalized message. You also have the access to our COVID-19 message library, and right now we have over 45 messages, 8 that would come preloaded into your account. They're all in English and in Spanish, and again, at a 6th grade reading level or below. And the topics right now really range. So, we've kind of been watching this trend, with our providers and seeing what kind of content they've been sending. At the beginning, it was more about hand hygiene or social distancing, and now we're seeing a lot more content being fueled around testing availability or lack thereof in a lot of cases, clinic closures, some around the social emotional support, and most recently, even on social determinants of health, making sure that their patients know where to turn to for secure housing or for accessing food during this time. So we launched CMLight, I want to say a week and a half ago, but time is kind of abstract to me right now. And in that time, we've already had 24 free clinics and FQHCs get enrolled and start messaging patients, and they've got over 340,000 patients. And then overall, including our current kind of provider base, over 117 customers have sent 3.6 million messages around COVID-19 to their patients in the last 3 weeks. So the map on the right shows the patients messaged on COVID, just specifically around COVID-19 by state. And this was recent last week, so we'll be updating it this week on the website. So lots of interest here in CMLight, and I think providers are appreciating the ability to just get up and running quickly and be able to effectively communicate with their patients around some of the changes that are happening in the clinic regarding COVID-19. Great, so now I'm going to demo for you what this looks like. So the first thing you'll do is you'll go to caremessage.org and click login. It'll take you to the sign in page. And then it'll take you to the home page of CareMessage. And here you can see the dashboard. The first thing I'm guessing you're going to want to do is get all of your patients enrolled into CareMessage. And before I dive in, I just want to say this is a demo account, so none of the information in here is real. There's no patient information. So I'll click Create New and File Upload. And from here, you want to choose a file. And this will be a file that you've already downloaded from your EMR. And I'll show you kind of what this looks like. So you can have your MRN here, your patient first name, last name, phone number, and language preference. and choose the file, and then it'll take you through a couple more phases just to make sure that the fields are mapping correctly with our system, and it'll show you any errors that it's generating, and then you'll be done. You'll have all of your patients in CareMessage. And the next thing you'll probably want to do is message them. So you'll go to Create New and Outreach. And here you can select the patients that you've uploaded. So this is a nice feature. It allows you to filter your patients. So if you added, let's say, date of birth to one of the fields in the file upload that we just looked at, you could, filter your patients by age. So if you only wanted to send a message to patients who are, 55 or 65 and older, and talk to them about, kind of the risks involved with COVID-19, you could do that. If you wanted to send a message to your 20-year-old patients and talk to them about social distancing, you could filter for that in here. But for the purposes of this demo, I'm going to say I want to message all of my patients. So I'll select all and save the changes. And now they've all been selected to send this message. You have the ability to upload your content from a template, although you can create your own content or copy and paste from one of our messages in our library. But you'll have 8 preloaded into your account. So I'll choose the COVID-19 social distancing. And everything kind of populates on its own. So you can change the title if you'd like. It'll send via text, and it can also send via voice for patients who have a landline. If they have a mobile phone number, it'll be sent via text. And then you can also, make this a response required or, a response suggested question. You can ask a question to patients, or you can just say that there's really no response needed. And for this example, there's no real response needed. So I'll keep it pretty simple for the purposes of the demo. But here you'll see that the template already preloads the content. So practice social distancing and stay 6 feet away from others. Refrain from hugs and handshakes. If you are sick or at risk, stay home, please. You could include a phone number to the clinic if they have questions. And it's important to click both the English and Spanish, and it'll automatically send the message to the patient in whatever language preference you already selected with the EMR file upload that we went over. So from here, everything looks great. I like the content, and now I'm going to schedule it. So I want it to go out on the 3rd at 10:15 a.m. And then I would click create, and that would be it. Then they would be sent to all of my patients. If you wanted to check on the status of the outreach or see what the responses look like, you'd go into your outreach tab and find the message. So here, I'll pretend like this is the message. Here you can see the summary of what was sent and to how many patients, and I'll click on the Patients tab. Here are all the patients that received the message and the message content on the side here. Since this was a no response question or statement, we're not seeing a ton of patient responses, but this is where you would see them if you did ask the patient a question. And let's say that, Francis, instead of saying, okay, said, hey, I really want to get tested for COVID-19. How can I do this? You might see that patient response here and want to follow up with him. So then that would take you to the other feature that we offer in CMLight called Messenger. And this is just a direct, like you're texting your friend conversation that you can start with any of your patients. But here I'll try to pull up Francis and I'll type him a message. I'll say, hi, Francis. This is Nina at CareMessage Call Center. I saw your question. Please call us at 555 to review your symptoms. And you can press send, and then that would go out to Francis. Some other, you don't have to use this feature to just follow up with patients from outreach. You can start brand new conversations with patients. Case managers have really appreciated this feature. Just even simple things like coordinating a time to contact a patient instead of playing phone tag with them a million times, or letting them know that we're moving to telehealth visits. Like, you're gonna receive a link in your email around a telehealth visit today. Simple things like that you can also use Messenger for, or checking in with patients who maybe have COVID-19 and checking in to see what their symptoms might be, or how they're feeling, or how things are progressing. But this is a kind of a one-to-one communication platform that you can also use. Okay, great. So I'm going to sign out. Go back here. So you can sign up for CareMessage by going to caremessage.org. We can do that right now. You'll click on View Free COVID-19 Messages from our homepage. And this will take you to the CMLight homepage, and you can find more information about CareMessage Lite. This is the map that I showed you previously. You can see some of our partners and our customers, more information about CMLight, a demo video that goes, that reviews the similar things that I just went over. And then at the bottom here are the two things that might be most important. So here you can click View Free COVID-19 Messages. And this takes you to the library that we talked about. This is open access. So anybody can access this, and you can copy and paste anywhere you'd like, but you can see all of the different messages that we've curated over time here. And we definitely try to see what providers are sending to their patients, and make sure that we're disseminating some of those messages broadly, and just sharing best practices with our base. And then down here is the form that you'd fill out if you're interested in getting started with CMLight. And then after you fill out the form, there would be somebody on our team would reach out to you. There'd be a quick onboarding process, and then you'd be able to message your patients right away. And I just want to emphasize, this is a 60-day free trial. There's no obligation, no form of payment collected at all. And that's it. Thank you so much for joining today. I hope this was helpful. I know, as a nonprofit at CareMessage, like I mentioned, our mission has always been to serve vulnerable populations, and we just feel like there's just never been a more important or urgent time to do this. And so I wanted to also take this opportunity to thank you all, especially the healthcare workers on the call today that are on the front line supporting patients. We're just so grateful for the work that you do, and we really hope that we can continue supporting you in any way that we can.
Yeah, this is Dorado Brooks again. Before we get into Q&A, can I just follow up?
Oh, sorry, Dr. Brooks, were you talking? Did you say something?
Yes.
Oh, sorry, I didn't hear you. What'd you say?
Before we jump into the Q&A, I just wanted to follow up. Thank
Sorry,
you.
I still can't hear you.
Let's go ahead. Hi, everyone. This is Christine Chang with CareMessage. I think that was just a transition over to our Q&A, and I see a lot of questions here.
Oh, okay.
Thank you, folks, for submitting these. If we cannot answer your question live today, we will do follow-up via email to address any questions that we don't get to. So, Nina, one of the first topics that's coming up is around language support. Folks are asking who's doing the Spanish translations, and is it possible to send messages in other languages such as Portuguese or Creole?
Yeah, it's a good question. So at this time, we only support English and Spanish. but we have seen that some providers are kind of testing the fields and sending messages to patients in different languages. It's just not something that we can guarantee works at this point, but it's something that you can, potentially test on your own and see if it's meeting your expectations and send to patients. We do have 2 people on staff. Both are our program manager, Nicole, and our VP of product, Cecilia. Both are native Spanish speakers. Nicole has been helping review all of our Spanish translations, and she has a certification in translation from UMass Amherst.
Great, thank you. We have 2 questions on CareMessage's text-to-voice capabilities, if it is possible to send messages via voice, and if there are any fees charged to the health center for sending voice messages.
So yeah, it is possible to send messages via voice via our outreach feature. And so you can send it via text or via voice. If you click both of those, then the system will figure out if it's a mobile phone, then it'll try to send via text. If it's a landline, it'll try to send via voice. And then in terms of the costs for messaging, or for the fees that would be incurred to the health center, I'm not sure I understand the question, but there's no, the fees would be, the main concern that we hear from some providers is like, is there a fee for the patient to receive some of the messages? And so most patients have free text messaging available, and so that's why we encourage enabling text messaging. But I'm not aware of any fees that would be incurred to the health center for voice specifically.
Great, thank you. We have a few questions around the file upload process. And Olga, if you're still on the line, if you don't mind clarifying your question a little bit further while we're on the topic of file upload, please do so. Other questions we have around file upload is confirming that patients do not self-enroll into this and that health centers would enroll them into receiving text messages. And if a health center should use an opt-in file, an opt-in list that they have on file typically before messaging patients via the app.
Yeah, so sorry, Christine, can you repeat the very first question you asked?
Yes, so if they would need any file and confirming that folks, patients do not self-enroll.
Okay, right. So yeah, so yeah, this is where it's really kind of up to the health center in terms of what strategy you want to take with your patients. We have had some health centers ask patients to opt in to some of the text messages. We've seen really, really low adoption with that. So that's why we do kind of encourage providers to allow patients to opt out by telling them in the welcome message, we're going to be sending you some messages around COVID-19. This is an easier way for us to communicate at this time. You can text stop to opt out at any time. And that gives them the freedom to opt out. But receiving confirmations to opt in is just, we've seen just really low adoption rates with patients that way. So it is a total, when you upload the file to CareMessage, those will be all of your, those could be all of your patients, or they could just be the patients that have opted into this communication that you already have on file. So it really depends on, what file you upload and how you're filtering your patients.
Great. We have one question around CareMessage and HIPAA compliance. How are we addressing HIPAA, and are we engaging in BAAs with health centers?
Yes. So part of the onboarding process is signing a BAA MSA, so that will be part of the process. And then we are HIPAA compliant, and we can share more information during the onboarding process around any specific questions or concerns that you have about our technology.
Great. 2 questions on patient data. Where is patient data stored? How is it secured? And is there a way to not upload our data but tie into the EHR? I believe they're asking about integrations with the EHR there.
Yeah, so with CMLight, thanks for asking that question. There's no integrations, so it's just in the UI. And I think that would be a good question. We can follow up with more detailed information about how data is stored and more about our HIPAA compliance, if that's something that we can send. Christine, is that okay to send after the webinar to the registrants?
Yes.
Okay, great.
Great. Another question is around how can we create groups of patients within CareMessage?
Yes, so you can create groups within CareMessage, and there is a groups feature that will allow you to, so if you did want to group patients by age or by opt-in, you can easily do that on the platform as well. It's not something I got to demo today, but it is available in the Help Center, and you can watch a demo of how the groups are created there.
Awesome. One question is for folks that are already using CareMessage, how could they do this type of messaging?
Oh yeah, if you're already using CareMessage, then if you're already a CareMessage customer, then you've already got these resources available to you. So I'd encourage you to reach out to your customer success manager, let them know you came to the presentation today and want to get started messaging around COVID-19, and we can definitely get you started.
Awesome. Going back to the group question, the question was just confirming that the ability to create groups and that feature is available on CMLight.
Yes, it is.
Great. We have one question about some protocols that we are following for CareMessage staff. I believe this question is perhaps in reference to talking about employee wellness during this time. It looks like it's from an anonymous attendee, so if you do want to clarify your question, if I've misinterpreted it, please do so, but I believe that's what this attendee is asking about.
Yeah. Yeah, some of the things we've done is we've moved some of our meetings to be a little bit more regular. Just so that we have more touch points with each other and are better able to communicate. One of the things that's unique about CareMessage is we've actually been a remote company for over a year now. So in some ways we were kind of in a little better of a situation, in that we already know we have some of the communication strategies in place to communicate while working remote. But we really focused on, okay, how can we better support our managers? What are the tools we can give to them? Specifically, we just had a meeting where somebody talked to us about, like, what are the questions you can ask your direct reports that would make them feel supported? What are the resources we have that you can let them know about? That we're offering, and how can we really have a support, provide supportive language for our employees, along with just really being flexible with people's schedules. Some people are watching their kids while they work now, which is something they maybe didn't do before, even though they were working remotely. And so just really, it's about the connection, I think, with with the manager and with the operations team and the human resources to make sure that we're disseminating our resources widely, and we're just really trying to be accommodating. And I think just the mantra that I know with my team I've been saying is just, we're going to do the best that we can, and we're going to support each other along the way, and just trying to disseminate that message, we hope is helpful.
Awesome. And as a very last question, it seems like a clarification came in for that question around protocols and best practices for health center staff when using CMLight.
Oh, so just best practices when using CMLight. Is that the question?
Correct. And any protocols we would recommend.
Oh, okay. Yeah, I think it's helpful to have, one or two people who really understand how to upload patients to CMLight, who are in charge of messaging, and who can really understand the technology and make sure that the messages that are being sent are in fact to the patient population that you want. So I think having kind of a centralized person or two can be really helpful. And then in terms of protocols, I would say making sure that your team is aware of some of the messaging that's available and getting their buy-in or approval, or letting them even just know that that you're using this powerful tool now, and that if there are messages or there is content that we need to get out there to our patients, that this could be one of the ways that we do it. So I think just making sure your team is aware that you're using this, and then making sure that there's maybe a point person or two who can really understand some of the best practices and file uploads and messaging patients and checking in on their responses.
Great. Thank you, Nina, for answering a wide variety of questions. For any additional follow-up questions that perhaps we didn't get to today, I think we got to all of them, but as they come up, please don't hesitate to reach out to me, Christine Chang, via marketing@caremessage.org.
Great, thank you. And thank you again, Dr. Brooks and the team at ACS. So appreciate this opportunity, and thank you to everybody on the call and all of your hard work. Really appreciate it. Thanks, everybody.